How women perceive their social status could have a bearing on their heart health. It may seem strange, but it's one of the takeaways of a new Canadian study, and it adds to growing evidence that social and psychological factors can uniquely affect women's cardiovascular risks. Joining me now to share more about this fascinating link is Dr. Judy Luu, a clinician scientist at the Research Institute of the McGill University Health Centre and a co-lead author of the study. Dr. Luu, thanks so much for being with us.
Hi, thank you so much for having me.
Okay, let's start off by talking about this study. What did you set out to find, and what did the study entail?
Absolutely. So we know that heart disease is the leading cause of death for women, but the tools that we use to assess this risk often doesn't take into account this full picture. So especially things like your social and emotional factors. So things like income, education, and how supported someone feels can all impact heart health. And in our study, we were really interested in one question. So does how someone feel about their place in society, so what we call subjective social status, does this relate to early signs of heart stress? And does that differ between men and women? So in our study, we looked at over 400 people and we asked them to rate their own social standing on a simple 10-point ladder. And then we used MRI to look for very early changes in the heart muscle. And we looked for signs of inflammation that can show up well before someone has symptoms or before they can get diagnosed with heart disease.
And Dr. Luu, what did the data reveal?
So what we found was pretty striking. We found that for women, those who saw themselves as lower on the social ladder showed actually more early signs of potential heart inflammation. And this held true even after we accounted for things like income, education, and actually all those things when we accounted for things like income and education, which was the same when compared to male. And for men, actually, that connection wasn't true. Their self-perception didn't seem to have the same impact on their heart. Sorry about that.
Very interesting. So are there any theories to explain these findings? Do you have any ideas as to why this could differ so greatly?
We actually have a couple theories. The first is that this kind of self-rated status might actually reflect women's lived experiences more accurately than things like income or their job title. So even, for example, if a woman is well educated, she might still feel those social pressures, discrimination, or feel undervalued, and that can affect how she sees her place in society. The other theory, which we hypothesize is probably the bigger one, is that women may be more biologically sensitive to the effects of stress. We know from other studies done before us that women tend to have a stronger stress-related inflammatory response due to everyday stressors, worries, etc. And this could really be explaining the changes that we're seeing in the heart in a woman compared to a man.
As you mentioned, 1 in 3 women in North America do die from heart disease, yet women are less likely to receive important cardiac interventions. And you say this highlights the need to rethink how we assess cardiovascular risk in women. So could this data be a step towards that?
100%. So right now, most heart risk scores that are done in a family doctor's office or a specialist office are based on things like your cholesterol levels, blood pressure, diabetes status, etc. But for women, those numbers might not tell the whole story. And what our study really shows is that stress and social pressures and how a woman feels in her everyday life might already be affecting her heart even before there are symptoms or development of heart disease. So yes, I think this is a major step towards rethinking how we assess and how we care for women's heart health. We need to start including mental wellness and social context in our everyday conversations when a woman goes sees her specialist.
So what's next for this research? Does this open the door for more study?
Yes, so absolutely. We're planning to follow these participants over a longer period of time to see how these heart changes can actually predict who will develop heart disease later on. So things like heart attacks, strokes, etc. We're also really interested in whether improving these social supports or reducing the stress level, could it actually reverse or prevent these changes that we're seeing in the heart on our MRI? And so our overall goal going forward is to really have better earlier detection, more personalized care, and importantly, better prevention, especially for women and, importantly, women and their families. So we want to make sure that women who are often underdiagnosed and undertreated when it comes to heart disease really get brought to the forefront.
All right, we will leave it there. Really interesting stuff. Dr. Luu, thanks so much for being with us.
Thank you so much for having me.